My name is Martin Citardi. I'm a fellowship-trained rhinologist based in Houston, Texas. I have been interested in surgical navigation and registration in particular, essentially for my entire career. I know from personal experience that getting good surgical navigation accuracy requires attention to registration. It's important for routine sinus cases and to the most complex skull-based cases that we do in a variety of settings, from offices for simple cases to the most complex cases we do with neurosurgeons in the main operating rooms. Today we're going to discuss TruDi surgical navigation. I'm going to show you some of the particulars about this particular system, but also discuss some of the general concepts to get good registration to support good surgical navigation accuracy. I'd like to talk to you a little bit about what it takes to do good registration to support surgical navigation during endoscopic sinus surgery. You have to remember that there are 4 critical factors. The first is the quality and type of CT scan. The second are patient factors. There is factors related to the system that is being used for surgical navigation. And the last and also often underlooked factor are factors related to the end user setting up and using the system during surgery. The first part I'd like to talk about is that related to the CT scan. Not all sinus CT scans are good for surgical navigation. They need to be at 1 millimeter or less in slice thickness. The scan data needs to be axial with no gantry tilt. And the entire face, including the forehead, needs to be included in the CT scan. That is important because today's navigation systems in general rely on a contour, and you need a broad facial contour in order to get good accuracy from registration. The other factors also that sometimes come up is a discussion of cone beam versus conventional CT scan. Both are adequate for surgical navigation. The preference really depends on the user. Cone beam scans look a little bit blurry, but they are more than adequate for surgical navigation. The next factor we need to discuss are patient factors. The simple truth is that it is easier to register some patients versus others based on the shape of their faces. Someone who has a very round face without many facial distinctive features is going to be more difficult to register than someone who has a face that has more angular features. You can register both patients, but in certain instances you just have to take more care in order to get the results that you want. When doing registration for sinus surgery, you also need to consider the system that is going to be used for surgical navigation. There are multiple systems that are available for ENT, and they all have different features that need to be considered. Today, most systems are based on electromagnetic tracking, which is easier for ENT surgery, but in the past, optical systems were used, and in some places, optical systems are still available. Other system factors include the registration protocols, the coding in the software that performs the registration. As end users, we tend to think all the software code is basically the same and interchangeable, and in practice that is probably not true. There are different assumptions that the software engineers bake in to their coding that performs the registration calculation, and you need to recognize that there's going to be different performance as a result of the output. Another important factor is related to the hardware. With electromagnetic tracking, there are different types of electromagnetic field generators and sensors, and some of these systems are more robust. If there's more redundancy in the system, when there is some perturbation of the electromagnetic field, the tracking will remain intact and the registration is going to seem to work well throughout the entire surgery. And then another important factor is the geometry and shape of the instruments that we use. Instruments that are finer, have a narrower point, are going to be easier to give a much more precise localization. And there are also advantages with having tracking at the tip of an instrument, because you can actually place the sensor right up against the target and get a much more precise estimation of what the accuracy is and truly visualize the anatomy. If you're tracking a very broad instrument, you simply cannot place it into a small corner. But on a CT scan, it may look like you're close and you're really not. So there are some issues with instrument geometry that need to be remembered as well. The final factor to consider is the end user with the system. We've shown in a couple of different papers now that there is certainly a learning curve. Our trainees do not perform as robust a registration as an experienced attending surgeon. and that is a reproducible effect. So when you're first using a new system, you have to give yourself some time for that learning curve, and you need to invest the time to learn the system well to get the right level of accuracy that you need for surgical navigation and endoscopic sinus surgery. Next, we're going to discuss the setup of the system and how we perform the registration. There are some important maneuvers that you need to keep in mind in order to get good mapping of the facial contour that's important for a contour-based registration. Okay, let's go through the setup of a navigation case with the TruDi Navigation System. Here we have the scan already loaded. I want to highlight a couple of settings options that some surgeons will find helpful. The first is the layout of the screen. Here we have the sagittal image in this quadrant. That's not my preference. I usually prefer to have the coronal at in that area. And it's very easy to click over to that setting on the right here under the Layouts tab. You also can adjust your scan parameters as well for window level and thickness as well, basically brightness and contrast if the scan is not appearing the way you would like it. Next step is to place the patient tracker on the patient. Typically, we prep the skin with an alcohol prep pad to basically take off any oils. Just makes it stickier. You don't want the tracking pad to move on the patient's forehead. And so it basically has an adhesive patch. It's pretty easy to apply. You don't want it to place it too high or too low because you want to have space around the area to actually perform the mapping of the points. And then you just basically plug this into the slot labeled patient tracker. Another important point when you're trying to do a good registration is making sure that you're staying within the area that's possibly can be registered on the CT scan. And by that I mean if the CT scan is limited and does not go far up the forehead, you need to stay a little bit lower down. In this instance, we have a great CT scan, it's not an issue. But in practice, if the scan does not go high enough on the forehead, as you're coming superiorly, it's very easily to be registering points in air on the CT scan, and that's not going to help you. So you have to be cognizant of that. The other important thing as you're working and getting your various points is to keep track of what the screen is telling you. It gives you a sense of the speed. If you're going too fast, there's a little gauge that'll warn you that you're mapping too fast. And it also makes sure that you're getting a good spread of the points in 3D space. The software looks for that distribution, and if you don't have a wide enough distribution, it won't let you progress further. Okay, let's quickly go through the registration process. The first step is to map out 4 initial points for a paired point registration. To do that, you select the registration button here, and it brings up the 3D model. To rotate the 3D model, it's a right click, and I'm gently rotating, and then it's a single left click to pick out the points. The first point for me is always the lateral canthus. I rotate the model again, put one at midline, and then lateral canthus on the opposite side. The final point is here at the base of the nose. Rarely you won't have a good CT and it might be cut off. If you can't get this point in well, you can actually place something here in the crease, which is a really easy point to localize to and identify on the CT scan. So the next step is just to map out those points. You'll notice that I always, most of the time, actually use 2 hands in order to brace myself so that I'm steady. I try to keep the probe perpendicular to the surface at all times so it doesn't get additional distortion. And I'll explain what that means in just a bit. So we're going to map out the first point. These points have to be done in order, so you basically map out the next point as the purple point. So at this point, we're ready to start mapping points to get the contour. Usually I start on the patient's top left, usually using 2 hands. I'm listening to the system basically giving a tick-tock, giving me the rate at which I'm mapping points. I'm also watching the screen to see which zones are being collected. So again, staying perpendicular to the surface. And you know, there's a sweet spot in terms of speed. Okay, the last zone I'm going to do are the nasal bones. Here it's a little bit tricky because it's very easy to lose that perpendicular orientation of the probe. And what I mean by that is, you know, you start here along the nasal dorsum, but when you come down the side, the tendency is to go like that. In reality, when you start at the dorsum, to stay perpendicular, your probe has to change angles a bit. And that's really important to get that good result. So let's map out these points. And then on this side, okay, so it's signaling that it thinks it has enough points. Rather than picking out a specific point to confirm the accuracy, usually I run the probe on a contour and I want to see it trace on the surface of the scan, which is very important, and I'm getting a nice contour there, so I'm happy and satisfied with that. Next step is to click the back button to move us to the next step. Now we quickly have to map out the 4 purple dots to confirm the registration. Click the back button, and we are ready to navigate.